my position is 4, and the reason is because I think we've done nothing for a very long time, and it hasn't worked. To that end, it's known that menopausal women, they have worsening disabilities at that particular time, and it's not because they're having new inflammation and they need escalation in their DMTs. What's actually happening is they're having neurodegeneration. That's worsening disabilities without relapses, without inflammation on MRI, and so there currently are no treatments. I don't think they do need escalation of DMTs, particularly at that age, 50, 55. And so what can we do? So far, there's no solution at all for them, which is really bad since women are the majority of MS patients. There's, of course, interesting data that women who have natural menopause or surgical menopause, either one actually, when they've had that for years, they do worse. For example, if it's earlier, they'll do worse 10 to 15 years later, as opposed to if they hadn't had earlier menopause. This is in non-MS patients. And so there's a tremendous amount of data. Actually, there are papers showing that estrogens are neuroprotective and that the absence of them is neurodegenerative. So that's the big picture. And I think it's time to do more than either not treat or treat with things that are for hot flashes, to prevent hot flashes for, a few months. So this is a much more serious situation when you've lost something neuroprotective and you're having evidence of worse neurodegeneration. And I think that it's time to address this.